So prophylactic internal iliac artery balloons is a procedure which is carried out in many centres worldwide. It was first described in the mid-90s, and since then the procedure has evolved. So in our centre, these patients are all managed in a multidisciplinary setting. We have a maternity hospital on site with the interventional radiology department, and that really highlights the value of having an on-site interventional radiology service in a large tertiary maternity hospital. So these patients are all identified in a normal fashion using routine prenatal ultrasound. There are a number of risk factors which increase your risk of having abnormal placentation, such as having previous caesarean section, in vitro fertilization, and so on and so forth. So these mothers are all identified in the routine way. MRI is only used as a problem-solving tool. Usually you can diagnose it with ultrasound, and they're managed in a multidisciplinary fashion. And what that means is the obstetric team that's looking after the patient primarily get together with the anaesthetist and the interventional radiologist, and they plan an elective procedure, which is generally what happens in our institution. What that means is that a planned caesarean section date is made with the mother. The mother is brought into the radiology department first, where she receives an epidural, and then into the interventional radiology suite. There, using standard angiographic techniques, we get access to her vascular system, put some catheters into her internal iliac arteries, and they're the arteries which feed the main blood supply to the uterus, and we place low-profile balloons. The balloons aren't inflated, and the reason we place low-profile balloons is so that it doesn't stymie the blood flow to the uterus before delivery, because that would obviously be detrimental. So these balloons are then left in place, and the mother is transferred to the obstetrics delivery suite. There, a caesarean section is undertaken in a normal fashion, and if there are any torrential bleeds or major obstetric hemorrhages, the interventional radiologist is present at the time of delivery. We can then inflate the balloons if needed in conjunction with the obstetrician, and that can be used to decrease the blood flow to the uterus and allow the obstetrician to get vascular control during the surgery. And that can often preclude the need for a hysterectomy, which would have traditionally been required in these cases. The sheets are then left in place during the delivery, and the sheets are removed later on after mother and baby are transferred out of the obstetric delivery suite.